Common mistakes the candidates make on the MAR and withheld drugs. It is highly likely in your OSCE test that the MAR chart you are given in the OSCE will have errors on it. You are expected to be able to identify the prescription errors, and once you have found them, you are legally bound by the NMC duty of candor to advise the prescriber, patient, and relatives where necessary. A stat dose has already been given. Okay, so I'm looking at the MAR chart and I can see under the PRN medications that paracetamol has been prescribed. Dose 400 milligrams, frequency 4 to 6 hourly, route orally. It has a signature from Dr. Smith and the bleep number is 7892. I can see that the nurse Douglas gave this dose at 07:55 am and it is now 2 p.m, so this may be due again. But wait, I can also see that a stat dose of paracetamol, dose 1 gram, route IV, was given at 12:15 p.m. The patient is not allowed paracetamol again within 4 hours, so this drug is not due yet. I do not mark anything in the box because it is not a withheld drug, it is just not due yet. It would be an error if you coded a PRN as not administered when it is not due. The prescription is incorrect. I'm looking at the MAR chart and I can see under regular medications that atorvastatin is due today at 8 am, which is the time now. Dose is 10 milligrams. Frequency once daily, route orally. However, I can see that the prescriber hasn't signed this prescription, so I can't give the drug at this time. Instead, I'm going to place a 6 in the box because it is an incorrect, unclear prescription. I'm going to code it now, so don't forget. I'm also going to write this up in the drugs not administered section. The reason I'm giving is that the prescription isn't signed. I will speak to the prescriber to get this signed before I give it. Patient is allergic to the medication. I can see the patient has been prescribed an antimicrobial. They have been prescribed amoxicillin, dose 250 milligrams, frequency 3 times daily. Time 8 am, 2 p.m, 8 p.m. The prescription has been signed and the bleep number has been given. Start date today, end date 1 week. It is 8 am now. However, the patient has just told me that they are allergic to penicillin, and amoxicillin is in the same drug family as penicillin, so I don't think this medication is safe for the patient to take. I will not administer this medication, and I will speak to the prescriber to see if a different antimicrobial can be prescribed. In the meantime, I'm going to code this in the box as number 10, Other. And on the back page of the MAR, under Drugs Not Administered, I'm going to document the reason as Patient Allergy to Penicillin. Speak to prescriber. Top tip. If you weren't sure that penicillin and amoxicillin were similar, you could look this up within the drug monograph in the BNF. Dose is incorrect. Furosemide has been prescribed to the patient. Date today, dose 400 milligrams. Time due 12 p.m, which is now. Frequency once daily, start date today, end date 3 days time. Prescriber name and bleep number is present. This is ready to be given now, but the dose seems really quite high to me. I'm going to check the BNF to see what it says about the dose. The BNF suggests that a more normal dose for this drug would be 40 milligrams per day, so I'm going to withhold this drug. I'm going to code it as a 6 in the box for prescription incorrect, unclear medication. On the back of the chart, under Drugs Not Administered, I'm going to state the reason as dose incorrect, and I will speak to the prescriber about this. Dose is inappropriate for the patient. I can see that the patient has been prescribed paracetamol. Dose 1 gram every 4 to 6 hours, frequency daily, start date today, end date 5 days' time. It has been signed by the prescriber and it has a bleep number. It is 8 AM now, and the patient has not already had a stat dose, but I can see my patient is under 50 kilograms, and I think this dose is too high for her. I will speak to the prescriber about this, but in the meantime I will code it in the box as a number 6, prescription incorrect, unclear. I will also document the reasons on the back page under drugs not administered as dose too high for weight. Other prescriber errors could include incorrect frequency, timing, lack of a signature, or lack of a bleep number. Medication is not appropriate for the patient. I can see that the patient has been prescribed stat dose of paracetamol. Dose 1000 milligrams by IV. Start date today at 8 AM. It is 8 AM now. It has been signed by the prescriber and it has a bleep number. However, the patient has just told me that they're not in a lot of pain and they don't feel like they need to take it. Given my patient doesn't feel like they need any pain relief right now for their pain, I'm going to code this medication as a 7, and under drugs not administered, I will specify that no pain relief was required. Remember, if the paracetamol was a PRN, you would not code it because it was simply not required. Patient requires OBS before medication is given. The patient has been prescribed bisoprolol. The date is today, the dose is 10 milligrams, the frequency is once daily, route is oral, start date is today, end date is 7 days, it's prescribed for 10 AM and it is 10 AM now. However, I know that one of the side effects of bisoprolol is that it lowers blood pressure. And when I asked for the patient's most recent observations, their last blood pressure reading was 95/55. The patient is currently presenting as hypotensive, so I don't think it is appropriate to administer the bisoprolol now. I will code this as 9, low pulse and/or low blood pressure. Under drugs not administered, I will write the reason as BP too low. Drug interactions and contraindications. I can see that the patient has been prescribed amoxicillin. Date today, dose 500 milligrams, frequency thrice daily, route oral, duration 1 week. Time due 8 AM, so that's now. Start date today, end date 1 week's time. Prescriber name is Dr. Smith, prescriber bleep is 6671. However, I can see that in addition to amoxicillin as an antibiotic, the patient has also been prescribed ampicillin, which is another antibiotic in the penicillin family. So before administering this drug, I will check with the prescriber that they can both be taken together. For the time being, I will code this as 10, other reason. Under the drugs not administered part of the chart, I will specify check interaction with ampicillin with prescriber. Side effects. I can see that the patient has been prescribed codeine phosphate for pain relief. Date today, dose 60 milligrams, frequency 30 to 60 milligrams every 4 hours to a maximum dose of 240 milligram daily. Route oral, duration 3 days. It is a PRN, so it is due as required and the patient has reported pain. However, the patient is suffering quite badly with constipation and has been experiencing abdominal pain as a result, so I will speak to the prescriber to understand if a different pain relief can be used. I will code this as 10, other reason. In the drugs not administered table, I will enter the reason as codeine may exacerbate constipation. Blood culture not taken. I can see that the patient has been prescribed co-amoxiclav. Dose 625 mg thrice daily orally. The prescription starts today and is due to end in 7 days' time. It's due at 8 AM and it is 8 AM now. It has been signed by the prescriber and the pharmacy, and it has a bleep number, so I know it is a valid prescription. However, I note that the blood cultures have not yet been sent. Until the blood culture has been sent, I will code this as 10 other. I will also record this under medications not administered as 10 other. Get blood culture sent off prior to commencement. Doesn't start till tomorrow. I can see the patient has been prescribed omeprazole as a regular medication. The dose is 20 mg once daily, orally. It is due to start tomorrow, and the duration is 7 days. I can see that it has been signed by the prescriber, there is a valid bleep number, and it has been checked by the pharmacy. However, as it is not due until tomorrow, I will not administer this medication until tomorrow. I will not code it as it is not due. Note that if this is a regular medication for the patient, and they have normally had it daily, but it has not been marked for administration until tomorrow, then you should verbalize that you would speak to the prescriber to get this amended to start today instead. Pharmacy check has not been signed. I can see that the patient has been prescribed warfarin as their regular medication. Dose is 5 mg once daily orally. Duration is 7 days and it is due to start today. The first dose is due at 12, which it is now, and it has been signed by the prescriber with a valid bleep number. However, it has not been checked by the pharmacy. Therefore, I will code this as 6, prescription unclear. I could also code it as 10, other. I will also code it under medications not administered. Remember to check your rights of administration carefully at the implementation station. There is likely to be a deliberate error in the MAR chart, and they're looking for you to spot it.